My name is Siyabonga Nzimande. I'm from KwaZulu-Natal. I work in the space of public health, research and innovation, but mostly to influence policy. I think for me, activism began at home. It's rural areas where I was raised up, and also the suffering that I got to be exposed into poverty, mostly HIV, and lack of quality education. Then when I became a better version of myself into an adult phase, I wanted to be the change that I want to see in the world. My activism is really on advocacy. It started on advocacy for treatment, to ensure that everybody that was HIV positive, they had access to treatment, but not just access to treatment, but they were also getting psychosocial support, and they were also getting nutrition support and workshops in the community to transfer knowledge around the communities. This aligns to the health equity in such a big way because we want to ensure that South Africa has a commitment, and probably why I'm here is South Africa has committed to end AIDS by 2030, but when you look at the indicators, we're not going to get there. So we're kind of moving towards fast-tracking cities and look at, are we starting off from the same ground so that we get into 2030? So right now the ground is not equal, so we're trying to equalize the ground, and that for me is health equity. So by me being here is to learn from what other forms of projects that are being done out there, what other forms of activism that has been done out there. One of the biggest takeaways for me is how we are dealing with our interpersonal skills and really getting to align. Are we at the same mindset? Are we speaking the same language? We may not really articulate it the same way, but at least the point of departure in our values is the same. So my key takeaway right now, even in this module that we're doing, is that I've got to understand what is this idea about health equity? What is this DNA? So that when I get to run out there, but I know that I got the right DNA with me.